Yeah, that is okay. I told everyone to mute the video and audio.
Okay,
Okay.
sir. And also,
Yeah.
my mobile you can't connect. After the session, we will connect. Okay, I'm just.
Okay, Prasanna. Okay.
Okay.
Welcome everyone. Thank you for joining us for today's webinar. Myself, Mr. Anand Isaac, Associate Professor, Department of Medical Surgical Nursing, Sarvodaya College of Nursing, Bangalore, as moderator for today's webinar. I request the participants who are unable to join on Zoom to join using keep your audio on mute. If you have any questions during the presentation, please type them into the chat box. I'll bring them up at the end of the presentation. And we will also have time for questions at the end. Now, without further ado, let's start. Today, we are conducting a webinar to gather knowledge and information regarding patient safety, as it is the foremost part of nursing. Our resource person for the day is Professor Mrs. Prasanna K, Senior Officer, Manipal Hospitals, Whitefield, Bangalore. To say about Madam has aspired BSc Nursing program from Dr. MGR Medical University, Tamil Nadu in the year 2000. Madam also completed MSc in Nursing in Medical Surgical Nursing from Dr. MGR Medical University from Tamil Nadu in the year 2005. Madam has completed PG Diploma in Diabetes Education in the year 2012. Madam has served as staff nurse in cardiothoracic unit in ICU from 2001 to 2003 from Apollo Hospitals, Greens Road, Chennai. And thereby, Madam started working as lecturer from 2005 to 2007 in Vijayanagar College of Nursing, Nagabavi, Bangalore. Madam also continued to work as reader, HOD of Medical Surgical Department and lecturer in Padma Shri Institute of Nursing, Bangalore. And thereby, Madam has got promoted as Associate Professor and HOD of Medical Surgical Nursing Department in 2016 to 2017. She has served in MVJ Medical College, Hoskote, Bangalore. Thereby, Madam stepped into a hospital as nurse educator in the year 2018, and she worked up to 2020 in Manipal hospitals. Now, currently, Madam is working as nurse educator, as also senior officer in Manipal hospitals, Whitefield. Madam has done more achievements in conducting programs and seminars in improving the nursing excellence for nurses. Now, I request our respected Madam to share the knowledge and experience on patient safety. Over to you, ma'am.
Yeah, thank you so much for introducing.
Thank you, ma'am.
Good morning, everyone. And as you all are budding nurses, we are, as a team, we are going to be you are all going to be a future generation of nursing. I thought this topic will be very apt for you. The topic is about introduction about the patient safety, like about the patient safety, and it is very basic. I'm just going to give a glimpse of the patient safety. I'm sure some of you have been to the clinicals already, and some of you are completed your clinicals. So you might have observed something, whether if I be a patient, I will not do this, I will not undergo this, like that. You might have got some idea how the nurses are treating the patient. So just let us go into the topic. So the outline about patient safety. We are going to cover introduction and definition of patient safety, the key dimensions of healthcare quality, harm versus error. What do you mean by harm and what do you mean by error? And sources of system error, patient safety culture, types of clinical incidents, and 7 levels of safety, and the physician's role in patient safety, and healthcare role in patient safety as well, and the case scenario. So after completing the lecture, you will be able to recognize the magnitude and importance of patient safety and define and describe the key elements and summarize the difference between error and harm, recognizing the characteristic of a culture in hospital and differentiate between the different types of clinical incidents and describe several specific behaviors you can practice to foster a culture of safety in your workplace. From the from the college itself, you can continue these behaviors. So according to World Health Organization, the patient safety is defined as reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. In the year 2009, this definition has been given. So significant number of patients are harmed due to their healthcare, either resulting in permanent injury or increased length of stay in healthcare facility, or sometimes even death. So around 44 to 98,000 deaths annually caused by medication error alone, medicine error alone. And there are more deaths annually as a result of healthcare than from road accidents, breast cancer, and AIDS. So we may be thinking that road accidents are high death, cancer, but medication error is the maximum cause of death in the healthcare facility. So you can just watch this video about how important is patient safety in a hospital. Maybe I can share the link. You can watch later also. This link is available in the YouTube. It is very basic what are all the harms a patient is having when they are in the hospital.
Okay, ma'am.
So why patient safety is a problem? Because the data is available from other countries. In India, we are not publishing the data. So we can see the year of data which is collected and number of hospital admissions happen, and the effect of the error or the harm to the patient is classified into adverse event. Adverse event is like there is a major injury happened or a patient is going for death. We can see that in the year 1984, the adverse event was only 3.8%, whereas the recent 214, it is 6.2%, and 2,950 patients had an adverse event in a hospital. So adverse event is they come for a procedure, for example, a simple procedure like appendectomy or something. But after coming to hospital, they have some error or some harm. They may fall from the bed or something will happen, which will cause a serious injury to the patient, and they go for the adverse event or wrong medication error alone. So they may have a major adverse event. So these are classified. So the increase in the number of adverse events is there, as well as the number of admissions are also increasing. So it is really a problem. It is not only in other countries, it is happening in India as well, but we are not publishing the data because all multi-specialty hospitals or the government insurance people are not ready to expose the adverse event. So we are not publishing, but it is also happening in all the countries. So here, what is key elements of professionalism? How it is applicable to any department, not only nursing, nurses, doctors, lab technician, everyone should have a high standard of professionalism when we start our career. So these are all the 7 elements: safety, effective, efficient, equal, timely, and family centered. We'll just go through few of the 6 dimensions of healthcare quality. Safe. Avoid injuries to patients from the care that is intended to help them. For example, now you are being a first year and second year. You might have observed that starting an IV cannula is a challenge as a new nurse, because before nursing, we do not know what is the IV cannula. So now you in first year, you will be learning. So we should avoid multiple prick to the patient. From first year itself, you can start doing like this. So we are not harming extra injury to the patient. That is a basic thing you can start from. That is safety of the patient. Avoid extra injuries. And effective, providing services based on scientific knowledge to all who could benefit and refraining from providing services to those who not likely to benefit. Avoiding underuse or overuse. So doing the right thing for the right person at the right time is effective. So this is applicable for starting a cannula. Same example we will take because you are familiarized with this procedure. So effective means you want to start a cannula for a patient, bed number so and so A means you have to start the procedure for A patient only. You cannot assume that B patient also has a cannula, so let me go and put the cannula for the B patient. Same way applicable to medication. You want to give for A patient, but you're giving for B patient. It is a harm to the patient. So providing services.
Excuse me, ma'am. Ma'am,
Yes.
slides are not visible on the screen. It's not moving, ma'am. It's not changing. We are seeing only the first slide.
Oh God.
Yes, ma'am.
Let me stop sharing and continue one second.
Sure, sure.
Actually, by mistake, 2 times I have logged in, I think. Now you are able to see?
No, ma'am.
Could you please tell me which slide you are seeing now?
We can see now, ma'am. 6 key dimensions of healthcare quality, safe and effective.
Fine.
Yes,
So we were just discussing, sorry for inconvenience. There were 6 keys of dimension. The first one is safety. We have just discussed how safe we can do your procedure. You start from basic procedures. So I'm just quoting an example, how your first year, second year, whatever you have observed. So effective. So here provide services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to benefit. Whatever is right for the patient, you are doing the procedure rightly. So that is an effectiveness. You have to give medication for A patient, you will go and give for A patient only. And the third quality is efficiency. So suppose timely, reducing waits and sometimes unfavorable delay for both those who receive and those who give care. So we should provide timely medicine. That is why we have certain medicines twice a day, thrice a day, like that. So we have to give the medicines correctly. So patient also will be benefited, and we will also manage our time effectively. And family centered, providing care that is respectful of and responsive to individuals' patient preferences, needs, and values, ensuring that patient values guide all clinical decisions. So anything doctor discuss with the patient has to be discussed with the patient family also. Because patient may be willing, patient family may not be willing, or sometimes vice versa. So we should always provide quality care having all the 6 dimensions in mind. So it should be family centered. Next is efficiency, avoiding waste, in particularly waste of equipment, supplies, ideas, and energy. So now this example of cannulation, if you take, you should be efficient to start a cannula in 1 prick, so that you will not avoid the waste of another cannula, and also wasting of your time and wasting of your energy. So you should be efficient in doing all the nursing procedures, not only cannulation. I'm giving an example. So every nurses should have a efficient knowledge. Then equal, providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. So all the nursing team should provide care equally to all the patients. We should not have any bias over the gender, ethnicity, or any other reason. For example, if we take, I'm from Karnataka. If I see a Karnataka patient, then we should not give more care to them, or we should not give more preference to them. So quality care should be maintained for everyone. So these are all the 6 key dimensions which you can follow from now onwards. So this will help to balance the high quality care. So where the error happens, how the error happens, what are all the sources of errors? So if we take into this, there are classified into 2 main groups. One is active error or human error, which are committed by frontline staff and tend to have direct patient consequences. And the so for example, giving the wrong medication, treating the wrong patient, or the wrong anatomical site, or not following the correct policies and procedures. So human errors are caused by various reasons. One among that is a new nurse or a novice nurse. So I do not know how to do a cannula, so that may be a common error. I do not know how to give a medicine. That will be a reason where when we give a medication, we may give it wrong time to wrong patient. The second aspect of the group is latent or system errors. See, these are the errors that occur due to a set of external forces and indirect failures involving management protocols, processes, organizational culture, transfer of knowledge, and external factors. So this, for example, it is not relevant to the staff, but it may be due to the other factors. So like, for example, suddenly there is a failure of supply of medication. We do not know how to give the medicine. So that will be a latent or system errors. So, example is understaffed or inadequate equipment. So mainly we will focus on the errors in medicine. This is the major cause of adverse drug events or adverse event in a hospital. So errors in healthcare can be caused by active failures or latent conditions. So this, if you take one error in medicine, this is also maybe due to a human error or the latent condition. Most errors are not as a result of personal error or negligence, but arise from system flaws or organizational failures. So here, for example, this model, no, you're going to learn from, I think from your 4th year of nursing, you will be surely in management, you will learn this failure of models. Failure model is mainly due to Swiss cheese model. Any accidents which is caused by Swiss cheese. So when you cut a cheese like this, you will have different holes, and all the hole, if it is in same direction, then the error will happen. So sometime, for example, I always start a cannula correctly. Once in a while, I won't get in 1 prick, it is fine. But I always give the medicine correctly. but one day the medicine from pharmacy did not come. So when there is a matching of the losses to the hazards in the same line, then surely one time the patient will have the adverse event. So here, for example, when we see doctor did not read out the route of administration, so I assume and give one route. So then like that, it may be happening multiple times. Okay, then doctor unfamiliar with the protocol and procedure, so he may give one medicine. Then pharmacy said sent up 2 drugs in one bag, syringes in similar appearance and design. So it always happens like that, but one time everything happening together will lead into a hazard. So patient is late and you want to give the medicine faster, so you didn't check, cross verify, then the hazard will happen. So there are small things which happens in at the same time for one patient, it will result in a major hazard. So this is called Swiss cheese model of accidents. So what does that say? The systems have many holes, some from active failure to some from latent condition. So these holes are continuously opening, shutting and shifting their location. In any one slice, they do not normally cause harm because the other intact slices prevent the hazards. Only when the holes in many layers momentarily line up does the trajectory of accident opportunity which reach the maximum effect and the victim get the damage. So the definition of patient safety culture. So we should have a culture of safety always. Then only this cheese model directs us to have a patient safety culture always, so that adverse event can be prevented. So what do you mean by this? An integrated pattern of individual and organizational behavior based on a system of shared beliefs and values that continuously seeks to minimize the patient harm that may result from the process care delivery. So this process care delivery will be set by the organization. But as a nurse, we should also follow the basic protocols which we learn in our curriculum. So if a patient is found to have received the wrong medication and suffered a subsequent allergic reaction, we have to highlight it. We should tell them that this happened, so we need to give the treatment for that. So we cannot blame the culture. We look for the individual student or a pharmacy or a nurse who ordered, dispensed and administered the wrong drug and blame that person for the patient's condition care at the time of incident and hold them accountable. This is exactly which is happening, but it is not the correct solution. Just culture. We look for the system defect, just as communication, protocols, process for medication management in order to investigate the negligence or recklessness of the worker. So we should always follow just culture, which will prevent us to blame the culture. Sorry. So the concept of clinical incidents, why all these incidents happen, how the basic concepts. A clinical incident is an event or circumstances resulting from healthcare which would have or did lead to unintended harm to a person, loss or damage or a complaint. This is what I said, like a mild harm would have happened or a major death. So this is a clinical incident. Example, medication error is a major big example we can take. Patient fall, intended self-harm or suicidal behavior of a patient, therapeutic equipment failure, contaminated food, problem with blood products, documentation error, delayed diagnosis, surgical operation complications, hospital acquired infections. So these clinical incidents are categorized into adverse event and near miss. For example, this I would just like to brief because it is a very vast chapter. So near miss is a harm which is going to happen, but somebody has observed or it was prevented. If that is not prevented, patient will go into an adverse event where it may have a mild adverse drug reaction or it may be a sentinel event, even a death can happen. So these are all the types of clinical incidents. To understand the types of clinical incidents, we should know this terminologies. Sentinel event. A sentinel event is an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. A serious injury specifically includes loss of limb or function. For example, here, hemolytic transfusion reaction involving administration of blood or blood products having a major blood group incompatibilities. So we always should follow the protocol of checking the blood bag as soon as we receive from the blood bank. So if major blood group incompatibility like B positive, B negative has been given, then surely the patient will go for a sentinel event. And one more sentinel event, like patient came for a mild appendectomy surgery, but he had a fall in the bed. Like from the bed, he had a fall because he was having an IV line and all those things, sleeping, and the side rail was not there. He fell down and he had a major head injury because the cot is near a sharp object. He had a major blood injury and brain injury, and he go for a comatose stage. Then it is a sentinel event. Another example. Next is about a near miss. A near miss, in any situation, it did not cause harm to the patient, but could have done if it is not prevented. This a wrong medicine dispatched from pharmacy is found by the nurse or somebody in charge that it is not reached the patient. They exchanged, then it is a near miss. So a near miss could be the next accident. So all this near misses should be reported. Unless we report, we will not know where the process failure has happened. So adverse drug reactions is another type of clinical incidence where this may be again a response to a drug which is noxious and unintended and which occurs at doses normally used in man for the prophylaxis, diagnosis or therapy of disease or for the modifications of physiological function. A patient is always getting a antibiotic. So we had to each admission, we had to check the test dose, then only we should give the antibiotic. Suppose you assume that last time he had this dose and now you are giving another antibiotic, then you may have assumed the same drug, but he might have got another brand or another medicine. So he may develop some reactions. So that is maybe ranging from mild reaction to major reactions. So these are called adverse drug reactions. So always any antibiotic test dose should be given, and anything, any medications administered, we have to watch for the uneventful reactions. So to understand the next about the patient safety, we need to know about the international patient safety goals. So based on the patient safety protocol, there are 6 international patient safety goals, which is guided by National Accreditation of Board of Hospitals as well as from the JCI. The first one being identify the patient correctly. We should always do it patient correct. Give medicine correctly, give medicine, blood transfusion correctly. Always we should identify the patient correctly. Second one, improve the effective communication. Among the healthcare professionals, we should have a same knowledge about the patient. The same thing should be communicated to the patient and family members. Third goal is ensure the correct site, correct procedure, and correct patient surgery. Always shifting the patient to the correct OT is a major important effect of this nursing. From nursing side, we should shift to correct OT. And goal 4 is about improve the safety of high alert medications. This you might be understanding, like various drugs like insulin, potassium, magnesium, and antibiotic. All these are high alert medication. We should always have a double check before administering. The goal 5, reduce the risk of healthcare associated infections. Always following the infection control protocols. The basic of prevention is hand hygiene. We should always follow the 5 moments of hand hygiene, which is guided by WHO. And goal 6 is about the reduce the risk of patient harm because of the fall in the hospital. So these are all like whenever patient is having some psychological issues or patient is on sedations, we should always put side rail, we should put and ensure that patient is not left alone. So this will prevent the fall. So these are all the international patient safety goals. So coming to the patient safety, the goals, all the 6 goals derive into the patient safety. As a whole, we had to follow all the 6 goals every time. So to maintain this clinical incidence, when we come to the safety of clinical incidence, we have to follow the national patient safety goals always. There is no excuse. So anything happen, we should report. How we can maintain the safety? We had to report the events and always client verification, medication reconciliation, like every day reviewing the medicines, whether this patient complaints are there, we have to change any medications, we have to consider. Then dangerous abbreviations, like we should not have any abbreviations at all nowadays as per the NABH. Minimal abbreviations only should be followed. And transfer of client information at transition points, mainly from one department to another department, we should hand over all the patient's details correctly. And control of concentrated electrolytes. This is about safety of high alert medications, which we discussed. Any electrolytes patient is getting, we double verify before administering. And infusion pumps training should be done as soon as you join. Many of the hospitals will give you, and we should ensure that infusion pump is continuously going on. Don't assume that medicine is going, then suddenly you will see it will giving alarm, then patient will develop a adverse dose. Then high alert medication we discussed. Hand hygiene should be followed always 100%. And antibiotic prophylaxis during surgery also, like correct patient, correct antibiotic should be given, which will help you to prevent the infection. Then fall prevention strategy, ensuring that side rails is there. Whichever hospital you go, they may have different kind of fall prevention strategies. You may just observe that. Very important that fall should never have in a hospital. Then pressure ulcer prevention, like patient is on unconscious and he is continuously on bedridden, he may have a pressure ulcer. You might have studied in first year. So as a nurse, it is a basic that we should proactively prevent the pressure ulcer. This is also one of the harm to the patient. And venous thromboembolism prophylaxis. So patient is on continuously on bed, he is prone for deep vein thrombosis, and as well as it will go for pulmonary embolism. To prevent that, we should encourage early ambulation. As a nurse, basically we study about ambulation therapy from the first year, so we should follow that whenever we started our career working also. And safe injection practices, we have to ensure that from the preparation till administration, we correctly give the right dose, right patient, right time, all the 10 medication administration rights, we have to ensure that. So these are all the safety of clinical incidents. Also safe surgical practices, which I said that shifting the patient to right OT is the basically a nurse can do. And identify the patient before shifting. And preventive maintenance program. So anything like if you go for any hospital which is NABH accredited or JCA accredited, they will have any equipments in the department, they will have a preventive maintenance program every 3 months. For example, weighing scale, whatever is measuring, BP apparatus, weighing scale, infusion pumps, everything which is measuring should have a preventive maintenance program. They have to be checked properly whether it is giving a right values. This has to be done sincerely. So these are all the safety culture, we can say patient safety culture we have to follow always. Now we'll have a case study. I would like to have 1 or 2 students to discuss what all is missed in the case scenario, so that we'll conclude with the last slide. So a 38-year-old woman comes to the hospital with 20 minutes of itchy red rash and facial swelling. She has a history of serious allergic reaction. A nurse draws up 10 ml of 1:10,000 adrenaline, that is the epinephrine, into a 10 ml syringe and leaves it at the bedside, which is ready to use. So here she assumes that doctor will advise adrenaline, so she loaded it and keep before the order is given. So just in case the doctor requested. Meanwhile, the doctor inserts an intravenous cannula and the doctor sees that the 10 ml syringe of clear fluid is there near the bedside that the nurse has drawn up, and assume it is normal saline, and he is flushing the line. As soon as the line is started, we have a practice of flushing the line. So what do you say? What are all you feel that patient safety culture is missed in this? Could you please allow someone to talk, Mr.? If anyone is
labeling
ready.
should be there for the medication.
Very good, very good. What is your name?
Somudip Maiti.
From which year?
4th year, ma'am.
Very good, very good. So there should be a labeling immediately after the thing. So that one step, if she has done, the major harm would have been prevented. Very good. So you're all already having some idea about the patient safety. Very good. Anything else? Anybody else want to say? Okay, so we'll just see what all.
Ma'am, we need to inform the doctor that I have loaded the medication and keep it.
Yes, absolutely. There should be a communication between the doctor and the nurse at this time. We'll just see what all can be done here. And the doctor gives all 10 mLs of adrenaline through the intravenous cannula, thinking he's the same saline. We cannot assume the medicine, so we should label. So he should have asked for a saline. Shall I have a saline to flush? So the nurse might have given. So that communication also is missed, and the patient suddenly feels terrible, anxious, becomes tachycardia, and then becomes unconscious with no pulse, like because after the adrenaline is given, that is the effect. So she discovered to be having a ventricular tachycardia, and she was resuscitated and fortunately make a good recovery. Recommended dose of adrenaline in an anaphylactic reaction is 0.3 to 0.5 mg IM, and this patient received 1 mg IV. So this is the treatment. You can learn that any anaphylactic IM should be given. So what is this type of event? We have seen some near miss or sentinel. Where do you assume that this scenario comes? Is it a sentinel event or a near miss? Anybody? Okay, so as no response, I am just telling it is a near miss. Suppose if the patient had a severe, if the doctor did not give resuscitation and she is not shifted to ICU, she might have died, then it may be a sentinel event. So the sentinel event is prevented by proper treatment, but still the patient had an adverse reaction of treatment also. So yes, so we should always look for the right practices from the first year itself. We should have the patient safety culture should be developed. So how can you identify the contributing factors for this error? Yes, you have already rightly said communication and labeling. Giving a substance without checking and double checking what it is, and lack of care without a potent medication. So it should be given a IM. Yes. I hope some awareness you all got about the patient safety. I will just come into the conclusion of the patient safety webinar. So patient safety is the avoidance, prevention, and amelioration of harm from healthcare. So we should always, for the patient safety, we should not avoid it. It is actually a preventable. We should give sincere effort always. And two approaches to the problem of human fallibility exist, that is the personal approach and the system approach. The personal approach focuses on the errors of individuals, like blaming them. Oh, she's a new nurse. She just joined 3 months old. She's just 1 year. That's why she did like that. That blame game should not come. We should identify why she did it, whether she was properly trained to give the medication or not. Okay, so the steps in medication given should be properly learned. We all learn in our curriculum, but it should be applied practically also always. And the system approach. The system approach concentrate on the conditions under which individuals work. Like here, the system approach is in the organizational perspective, starting from indenting the medicine till administration, what all chance of error can happen. We should do a study and prevent it. So the system approach also should be always available. And some errors cause harm, but many do not cause harm. But blaming and then punishing individuals is not an effective approach for improving the safety within the system. And adverse events often occur because of system breakdown. So 1 or 2 times the wrong medicine is coming from pharmacy. 1 or 2 times doctor did not write an order and we administer. Like that 1 or 2 will add up. and at the last there will be a big adverse or sentinel event will happen, then only all the systems will be observed. So we should always follow the observe the system approach, what all is happening, and we should correct. So we should report all the near misses. Standardizing and simplifying the clinical process is a powerful way of improving the patient safety. So all the system process from any, like if we take medication administration from order till we administer to the patient, we should have a simple clinical process. We should not have a complicated process. Yes, so patient safety is whose responsibility? Any idea whose responsibility is patient safety? So these are all the bibliography. Yes, I heard some voices. You can type in chat box whose responsibility is patient safety.
Nurses.
Nurses. Okay, good. Nurses are the first near to the patient always, but others are also there. Okay, doctors are not there with the patient 24/7, but it is everyone's responsibility. Patient safety is everyone's responsibility. If anything happened, they can't blame the nurses that we did it. So it is top management, from the top management till the staff nurse who's at bedside, it is everyone's responsibility. You understood something about patient safety? Yes?
Yes, ma'am.
Okay. Thank you so much. That's all from my side.
Thank
Any
you,
questions?
ma'am.
That was so informative.
That was so
Dear
informative.
students, if you have any
Dear
questions or
students,
queries, please
if you
post
have
in
any
the chat
questions or
box
queries,
so
please
that I
post in
will
the chat box so
ask
that I
madam.
will ask madam.
Yeah, Professor Prasanna, it was a very detailed information about patient safety. And thanks for accepting our invitation to be an expert for this session. And I think the participants, whoever have participated, has benefited by the informations what you have given on patient safety. And this is very, really very informative. And it will be very useful for the students who attended the webinar of the day.
Yes, sir. Thank you so much for the opportunity. And I'm really, I want to talk to the students. Actually, they'll surely get the patient safety, some idea. And thank you for the time. Thank you for the opportunity. And you'll be collecting feedback?
I think they have to again attend that post-test session.
Yes, sir. Same questions they can attend. Yes.
Okay, so everyone can now switch on to your questionnaire form that is shared with the G form, and you attend it and submit it. So,
if there is any
both the forms.
Do you have any feedback link?
Any questions or queries the participants wants to share? Yeah, Mr. Anand can take.
Thank you, ma'am. That was so informative, and I hope our students had a very good experience, and they had a very good notes about patient safety, which they will be applying in the future once they step into the hospital. Thank you, ma'am. Thank you for your good lecture and webinar. Thank you once
Okay.
again, ma'am.
Thank you so much.
Thank you all for joining. And also, I thank the participants and IT team for being for the webinar. Thank you, everyone.
Yeah, thank you for all the Sarvodaya team for helping the webinar. Thank you so much, sir.
Thank you, Prasanna, once again. Yeah, thank you, everyone.
Thank you, sir.
Thank you, ma'am.
Thank you, sir. Thank you.